How is everyone? Can you hear me? Let's see. I think somebody had a question. I did have, am I recording now? Yes. I did have some trouble. It's my first time trying to save the recording and upload it. So we were thinking that you were supposed to do it this one way, but it was actually a different way. So what I did, and it took forever, what I did was I recorded it, or I uploaded it on YouTube, and then I put that link on there. So I'm going to try it the right way to see if it works tonight after class, and I will upload it. But if not, the other way worked too. So if you wanted to access it, you hopefully didn't have any trouble with that link, because I had other people try it for me and it worked. But I'm going to try a different way tonight and see if it's a little bit faster. The video, when it's really long like that, because it was like right at an hour or a little bit more, it just took forever to load on there. I had to do it several times to get it to work. So how is everybody tonight? I was in a training all day today. Just got home, so I kind of have like mushy brain. You know, when you have to sit in something, I think it was an 8-hour training. So that was super long. It was good though, but you've been in trainings all day too. That's good. Somebody else is right there with me for that. Was everybody? Oh, I think somebody's not muted. Oh, there we go. Thank you. Did anybody have any trouble with either doing the quiz or the paper? Everybody was okay with that? I did have a few people that did the discussion board. So I'm going to make a note. It's okay if you did it this time, but just for this coming time, like don't do the discussion board. Just choose from either the quiz or the paper. Because I was real iffy on the discussion boards, because if only one person did a discussion board, it wouldn't really serve the purpose of what a discussion board is for. But I think I did have 3 or 4 people maybe. So if you did it this time, don't worry about it. Like I've got to go back in. I think I have all of that stuff graded except that. So if you did it this time, don't stress about it. But I was just thinking I'll probably send out another reminder, because if you weren't able to view the video or anything, then you wouldn't have known that. But it looks like everybody did well. Oh, you just got your book yesterday. Oh, and you just got back from the airport. Oh my gosh, I'm reading all your stuff now. Taryn, your car was totaled. Are you okay? That's an important question. If you're here with us, I'm assuming you're okay. Hopefully. That's awful. I hate stuff like that. I'm sure everybody does. Anything like that, those are my 2 worst things that drive me crazy, is car trouble and like no internet. I think I talked about that last class. So I completely understand. Most of the time, that kind of stuff. I have a 16-year-old, and she's doing early college. And I only have 1 child. So trying to, and you all can probably relate to me, trying to work the FAFSA and the financial aid office and figure out books and all of that stuff. The other day we went and waited in one line for about 40 minutes to get in the bookstore, only for them to tell us, you have to go to this office first. And then that took another 30 minutes, and then we were back in that line. So I completely feeling your pain on some of that.
Huh?
I think somebody's not mute. Oh, I can mute, or I can ask to mute. There we go. Oh, Mark, like that's a great day. This is the biggest, like this is the main thing you've had to do today. That's awesome. Does anybody have any questions before we start talking about the material from this week about anything? Everybody feel pretty good? Oh, good. And after tonight, I did make a note. This class kind of picks up quite a bit. That's why I think only having to do that one assignment, and then because in the next couple weeks, it kind of picks up a little bit, and you're going to start having another assignment on top of the paper or the quiz. And then in the next couple of weeks, also the readings like dramatically increase. So I think next week it's like 2 chapters, and then after that it's 3 chapters. And 2 chapters is a lot. Like that's a lot as a instructor, you know, to get you the highlighted information. But I think it's the following week, it's actually 3 chapters. So it's going to pick up quite a bit after tonight's class. All right, so if nobody else has any questions, I will go ahead and get started with what we have on the agenda for tonight. Okay, so your reading for tonight was chapter 2, and chapter 2 talks about the biological development in infancy and childhood. And remember, this book, you know, it's going to start out young, and then we're going to do all of the life stages as we go on. And it's going to be looking at that biopsychosocial pieces of all of those aspects. Why do you think it would be important for you to know biological development in infancy and childhood as a social worker? Just curious what your thoughts are on that start now. And I am so sorry if you can hear my dogs. They're outside barking.
His next friend Mike,
What are they talking about?
and he's gonna take him over to Oregon next time he goes.
I don't know who that is.
Let's see what we got. Oh, that's a great answer from Jasmine. It tracks normal development to track if someone is developmentally behind. Developmental milestones. Oh, that's a good answer, that could possibly be an indicator of abuse or neglect. It wouldn't always, you know, be 100%, but it would be, it could be an indicator of something there. So basically, we need to know that information, because one of the biggest things that we do as social workers is assess. We are always assessing and doing assessments, and we need to be able to monitor children as they grow. Some of you may end up in a career that this, you know, the biological development of children is very important to your job. An example of that would be maybe a social worker that's in a health department, and you're working with young moms or just moms in general, women who are pregnant. So that would be, you would definitely want to immerse yourself in as much of that as possible. So, and we're also in, you think about this class is human behavior in the social environment. And we know that the biological, psychological, and social development, all of those things work together as a system, and all of those things play a part in why people behave the way that they do. So all of those, we need to know those things because we're trying to figure out what the purpose of that behavior is, where the behavior is coming from, and all of those things have an effect on behavior. Hold on one sec. Oh, okay. I wish the only thing on Zoom with the old screen, you could see all the chats. On this one, you have to pull it up. It's like the one thing I don't like. Okay, I have another question for you. Out of you all who have children, like who are parents out there, and tell me how old your kids are so I can also gauge that as well.
Can you hear me?
Yes.
Oh, 6. Wow.
Oh, yours are 6 years old?
Yeah.
Right, thank you. Looks like a lot of them are the same. Some of you work with kids. 7.5 to 5. Oh, got some teenagers. Oh, that's exciting. 5 is awesome. And that I was just curious because it helps me when we're talking about these things. It kind of gives me a base of where your knowledge is on the development of children. Oh, I'm so sorry about that, Taryn. You definitely have a lot of childcare experience too. That's awesome. Because a lot of you will probably go on to work with, a lot of you may work with kids in some capacity. So in your book, I know there's a lot on your quiz this week where it's maybe talking about definitions. I don't really like to go over definitions unless somebody really doesn't understand something, because I feel like I'm kind of reading to you a little bit. So we're going to go through just some of the major stuff that's in this chapter. And so in the very beginning, it talks about the different trimesters. So when a woman is pregnant, there are 3 trimesters. That's why I like to know, like, who's had kids out there, because you probably know a lot of this information. And the first trimester is probably one of the most critical trimesters. It's when everything is beginning to develop. It's when you will see, by the end of the first trimester, there is a primitive heartbeat, there's a digestive system, there are little buds for hands, little sockets for the eyes. So there's a lot of stuff that happens in that first trimester. And it all starts with the brain and kind of goes down from there. The feet are always the last to develop. Let me see what, in the very, very beginning of your book, it talks about conception. And so it goes over what conception means, what ovulation means. And there might be, I feel like there's some questions for you about that, either on your paper or on a quiz. But it talks about a term that's really important when we look at like the 3rd trimester. It talks about viability. Does anybody remember or probably already know what viability means?
Like, chance of living?
Yes, viability is the ability of the fetus to survive outside of the womb without the mother's assistance. So I think it'll say in here around 22 to 25 weeks. If a child had to be born at 22 to 25 weeks, the chance of that child being viable is a lot lower. There's a big risk of death at that age. So you will always hear it's 40 weeks is actually, like a full-term pregnancy is 40 weeks. But we'll talk a little bit here in a few minutes about abortion. And so that term viability is going to be very important in the context of looking at abortion, because when you're looking at aborting a fetus, there comes that question of, is that if you abort a fetus, is it viable outside of the womb, and could it survive with medical help outside of the womb? So that's where that term really becomes important at looking at. What else? Oh, this is when you look on page 49. I feel like this is really important for you all to remember as social workers, is looking at prenatal influences. And that you might be in roles as social workers that you have an influence on educating or advocating for someone on prenatal influences. So you're looking at things like nutrition, you're looking at what drugs someone might be taking, illegal or, a prescription medication, alcohol consumption, smoking, how old they are, the amount of stress that they may be under. All of those things are going to play a role in that pregnancy, and could have detrimental effects as well on that pregnancy. This was a long time ago. I was doing in-home family therapy, and it was with a mom. Her son had, I think it talks about it in here somewhere. Her son suffered from spina bifida, and that was something I remember. She was a very young mom, and she didn't learn till after the fact that she had this child that had severe medical needs, that if someone had told her to take folic acid, that could have prevented that from happening. And so you think about, all she had to do was take that, but there wasn't anyone in her life. She wasn't getting prenatal care. And you have to think, like, if I'm a social worker, and let's say she was really young when she was pregnant, so depending on the circumstances, she may have had a social worker in her life. I just think about the ramifications that a social worker could have had on this woman's life, because she may have gotten her the information and the resources to get that prenatal care. And because she didn't get that prenatal care, she has a son that's probably always, the rest of his life, even, now I think, oh God, he's probably much older than a teenager now, requires medical attention and will for the rest of his life. So that's why I think it's so important, these prenatal factors that we as social workers can have an influence on. And it's whether, smoking can cause low birth weights, excessive drinking, that can cause fetal alcohol syndrome in children. And if you're in a school setting, sometimes if you're doing an assessment on a family, this is why this information is so important, because fetal alcohol syndrome kids can have hyperactivity disorder, lack of focus, lower intellect, and all of that can come from that fetal alcohol syndrome. So if you don't know that has occurred, then it's going to lead you, it could lead you in a different direction. So that's why these things are key to educate on the front end with clients, and also depending on what job you're in or how you're helping that client, you need to know that information to be able to help them. Does that make sense to everybody? Why those are so important? And, and you may not always know those. One thing with fetal alcohol syndrome, it actually has some physical characteristics that you can identify. They can have unusual facial features. Their eyes can be a little bit farther apart. There are some physical characteristics. And then when you combine those with some of the behaviors, you might be able to figure out to ask that parent, is this a possibility, or could this be in your try to figure out how to help that child the best you can in the assessment process. But if we don't know that information, it makes it a lot more difficult. And if you have any questions from this chapter, something you didn't understand, just throw it in the chat box and I will make sure we answer that. It shows all the different, on page 58, shows all the different forms of birth presentation is what they call. Like if a child is breech, where that is the bottom up, can make delivery very difficult and they may have to have a C-section. Sometimes Bianca asked, if a baby is born and have those symptoms, do social workers get involved? I will say sometimes you may not know that, right off the bat, but a lot of times a social worker may be involved because there were things that went on during pregnancy, so you may already know that this mom is heavily drinking and she's pregnant and there's been a report to Child Protective Services. So there are times when a social worker could be in that situation, could be involved in that situation when the child is born. And then other times someone may drink a whole lot during their pregnancy and people don't know, like it's just hidden. No one knows about it. Someone could be like a closet alcoholic. So I think it could go either way there. Depending on the situation and what's happened prior to the delivery of the child. It'll go through all of the different milestones for infants and children, developmental milestones. You could be in a position where you're providing family therapy and you're working with an 18-month-old and you need to know, okay, at 18 months, most babies are walking. This is what it looks like when they play. This is socially how they interact at this age. So depending, and it's good for you to have this knowledge just as kind of a foundational piece. There's some other classes that go more in depth on development, but it's good to have just a foundation to understand those. What are those? I'm not going to be able to tell what isn't normal if I don't have that baseline information, so to speak. And it will talk a little bit about nature versus nurture. Curious to see what your thoughts on that. And when your book talks about it, it's talking a little bit more about environment versus just hereditary aspects. So let me see where that is, because I always find that extremely interesting. I'll have to look for it in a minute. Maybe it's But what it's talking about is, oh, here it is on page 62. It says the nature nurture controversy. In here, it's talking about, environmentally, if a child is born, what's the example they use? It talks about a baby that's born in just a typical family. They're born with potential to grow and develop into a typical adult, both physically and intellectually. Like there's nothing abnormal going on. So they're saying nature has provided this child with the utmost potential to be developmentally normal. However, if you take that same baby and they happen to be living in an underdeveloped country during a famine, what's the difference in the environment that child may live in versus the hereditary, what nature is providing to that child? Which one plays the stronger factor? I tend to lean towards nurture a little bit more, because I'm thinking if you have a child that is, physically fit, but if they are living in an impoverished country in the middle of a war, their chances, like, it just makes no sense to me. Their chances of survival are not as high as they would be in a different environment.
Yeah.
What do you all think on that?
Like, for example, if they're malnourished, then they probably won't grow how they're supposed to grow. Their milestone could be, they might not reach the milestone because if they're malnourished, and then maybe the parent who's supposed to nurture them and help them, like push them forward, is not doing that. Because I knew this person who she had a baby, and she would just like keep the baby in the bassinet all the time, like instead of putting the baby on the floor so that the baby could crawl. So that kind of like prevented the baby to like miss that milestone where they would be crawling or walking. That then, like putting the child on the floor, letting them get like the balance, when they put them on the tummy time so that they could get the like balance and stuff like that. So I think nature, is it nature or nurture?
Yours would be nurture. No, okay. Wait a minute. I get all confused too. Nature is where they just have that, like they have the things, the physical things they have, and then nurture is going to be that
the environment. Yeah, so I would say the environment is more, because even some kids who like born with disabilities, if they have the proper nurture, they can actually improve and meet the milestones.
That's an excellent point. And someone else, let me see what somebody just said something on here that I was thinking sounded so true. It's about trauma. Oh, here it is. It was Jasmine talking about, if you've studied trauma, which you probably will, you may have not studied it a whole lot yet. I study trauma all the time, and when you're talking about, you could be living in like lower socioeconomic, poor conditions where you don't have the food, or different things that could inflict a trauma on you. Different, like, people handle trauma. Everybody handles trauma in a different way. But I've read studies where things can happen to people that are so traumatic, especially, it's when you're a child, that it has stopped growth. I've read books before that a child was sexually abused when they were 4, and at 6 years old, they quit growing for a year. And it took an entire year to figure out what had happened, this abuse that had continued over and over during this period in this child's life. And once that was established and acknowledged, and the child started to receive support and therapy, from that, growth started again after that. And that one always, just sticks with me, that something so significant, you can go through such a trauma that as a child, it can physically stop your body from growing. Yes, that's exactly what I'm talking about. It's very interesting on that could possibly happen. Like, it's just, I think it blows the mind.
Yeah, like what I think is like the mind is so powerful, it can control a lot of things. Just like if you're stressed, you could get a heart attack, you could get, like other physical pain in your body. So,
and it's also, if you think about, you could look at this from a ton of different ways. There's kids that grow up in the same exact house that they turn out completely different, on one spectrum of the other. One could be a complete professional, married, everything's great, and then the other one's a drug addict, been in prison several times, murdered someone. So, and then it makes me go, okay, that's a whole other something. Like, because these could be two kids that grew up in the same house with the same parents, the same socioeconomic status, and not necessarily, be at that where it was a bad situation, either. So it's just very interesting to look at that. But you need to know about that, because in order to assess, you have to know what is normal, what is appropriate, and what are those milestones. On page 69, it starts talking about abortion. And we talked a little bit in the first class about the code of ethics. And the code of ethics, I feel like, really influences how, of course, it has a massive influence how you work with your clients. But in this particular category, it's like we all, as social workers, we really need to know what our biases are when it comes to working with certain populations and certain topics and all of those things. But in social work, and especially in practice, looking at this particular topic of abortion, you have to put your own personal opinions to the side. Because what matters when you're looking at a topic like abortion, and when you go back to that code of ethics, it is our professional approach is what is going to matter. And if you look back at the code of ethics, we're there to help people. We're there to empower people. We are there to help people make decisions. But, ultimately it's going to be their decision. But you want those decisions to be informed. We're educated. That's one of the roles that we play, is to be an educator. Hold on, somebody. Oh, okay. Not a problem. So it starts on page 69, is where it starts talking about abortions. Let me find my right. I wrote a bunch of notes on this. I wanted you to know. So there's lots. When you look at abortion as a social worker, you really can see like the micro, the macro, and the meso. So you can look and see, how is this issue, how's this issue playing out on a meso level? Because it's going to tell you a whole bunch of court cases in here that play a part in whether or not a woman can have an abortion. What are the, oh, I'm sorry. Thank you for saying that. Meso, at the meso level, we're talking about systems. So, well, let me go back to micro. When you're working on a micro level with someone, that's going to be like that one-to-one client. That's a micro level. A macro level, you're going to be looking more at like families, communities, like it's going to be a little bit bigger in your social work practice. And then when you look at a meso system, you're looking at big, large systems. So you're looking at education, you're looking at government, you're looking at religion. Does that make sense? And a lot of times, as a social worker, you might be working with one client, but you're going to work on all three of those levels. It's like I'm getting into a different class. But you may have an effect on every single one of those levels working with that one client. So when you look at a topic like abortion, you're looking at, on a meso large level, the government has a huge impact on what is allowed, what the law says. I wrote down a couple things for you all just to think about. Like, it was in 1991, I believe, in Alabama, they outlawed abortion at any stage. So, including if a woman was raped or it was through incest. And so when I think about that, I'm immediately thinking, okay, so you have to look at it from, if I have a client and I live in Alabama and they're wanting an abortion and they're coming to me in whatever role I'm in that I'm able to help them. It's going to disproportionately affect lower income people. It's going to disproportionately affect African American women, Hispanic women, just because that maybe they don't have access to be able to go out of state. Like they're still going to try to have that abortion, but now they can't do it. They can't do that in the own state that they live in. So it's going to be, they're going to try to go outside of the state, and they may not be able to afford that. They've made it so that physicians in that state, if a physician in that state were to perform an abortion, they would face imprisonment from it. Hold on, I'm missing your chat because oh, yes. I'm so sorry if I said that too fast for you guys. Micro is going to be that one-on-one individual. Meso is communities. Bertha's on it. Macro, social, cultural systems. Oh, I had it backwards when I was looking at it. Oh, okay. You had another class that you just covered that. Thank you. I appreciate that. Okay, is everybody okay with that now? So I just wanted you to think about things like that, because as a social worker, in our core values, social justice, that is one of the biggest things that we do as social workers, is we challenge social injustice. And we do that for those that are vulnerable. We do that for those that are oppressed individuals. We talked a little bit last time about, we want all of those resources, those need to be equally distributed among people. So just in that one example, if you're going to provide that service, well, you're not going to provide the service in Alabama, but it needs to be equitable and it needs to be fair so that the woman that lives here has the same access to it as the woman that lives over here in a nicer neighborhood. And it'll talk a little bit about the National Association of Social Workers, what their official position. They say that abortion is a vital aspect of family planning. And we have to include abortion when consulting with clients about their own personal health care when it comes to starting a family or, whatever it is they're there to see us for. And you're not always going to be, of course, you're not going to be in a situation where you're faced with something like that every day. But it is something to think about as a social worker, that is something that you are going to challenge that injustice. And you want to educate, support, and you want to advocate. Like that's like, if you remember 3 things as far as what is my main role as a social worker, I'm going to educate, support, and advocate for my clients, no matter what the topic is. Go ahead, Natalie.
So if it's illegal in your state, but the person want to do it, what would we do?
You would probably have to educate them on, is there somewhere safe that they can go that's not too far away? Like you would try to find other alternatives for them.
I know, like where I'm from, it's a different country, Jamaica. It's illegal there, but there are a lot of doctors that do it still.
And see that, that makes me think, if you were to look before, Roe versus Wade, there was like, they were calling backdoor alley abortions, and where people would perform those, and it would be that somebody would, some people might die from it. Some people might not ever be able to have a child again. So if you're advocating and educating one of your clients, you're definitely going to want to steer them in something that's the safest, and the safest option for them and their health too. And you might even be in a position where, if you're seeing a client and that, let's say they can't get an abortion, and they come to you saying, well, I have a friend that knows a friend, and they said if I go to this building, maybe you're going to weigh out those, you're not going to make that decision, but you're going to try to weigh out those pros and cons with that client to get them to see that maybe this isn't the safest option. There's other options that could be safer. And it doesn't mean that you're just going to say, when you're educating them on, even if it's abortion or whatever it is, but that family planning aspect, you want to educate them on adoption. You want to educate them on, if you keep the baby, here's resources for you. Like, it's not like you're hardcore, I'm only going to stick with abortion. It just, that has to be included as an option. But you want to educate them on all of the family planning options when they come to see you. This is also when you're looking at the code of ethics, like the first ethical responsibility, that's always going to be to your client. That's very important. And you want to respect and promote the client's right to self-determination, so that they can you want them to be able to make their own choices on their reproductive, when it comes to their reproductive choices. And you challenge that social injustice, because it should include being able to be pregnant and having the right to terminate a pregnancy without governmental influence. So that's something that you want to, you want to advocate for that. And it gets really, it can be like such a fine line because, there's so many people that you're either on this side or you're on that side of the abortion, the abortion debate. So I think it's something that it's important for you to look critically at your own beliefs because, would you be able to do this, if the situation arose? Because you could think, maybe I'll never have to deal with that. I'm going to go into, I don't know, the only place you may not have to worry about that would be if you're in geriatrics. You're probably not going to have to worry about somebody being pregnant. Or if you're working with, there are different settings where it wouldn't be an issue, but there are a whole lot of settings, medical social work, school social work. There's a whole lot of settings where this could become an issue. And it's good to explore your own personal beliefs. And, to think about, if you are on one side that's different from the side to help your client, can you set that aside so that you can professionally respond to them in a different way? Let me see. See, that's like such Bertha's got the best question. That's very much an ethical, that could become, in your social work, that could become an ethical dilemma for you. And it's something you have to explore. Do I think that you can't be a social worker if you can't do that? I don't think it's that hard of a line. But that's me saying that.
Could you refer them to someone else if you feel like there's no way you can put your personal feelings aside and maybe can refer them to someone else?
Yes, you could probably do that. Depends on what kind of setting you're in, but because a lot of times there could be conflicts of interest and things like that.
Mm-hmm.
That maybe somebody and you can't have this person as a client for ethical reasons. So that could fall in there. But I think you have to really think about the issue when it comes to where you're going to work all the time. Because if that's something that could possibly come up all the time and you're completely against abortion, like that may not be, the place that you would be the best, professionally, and that you would assist your clients the best too. Does that help a little bit, Bertha? It's a very difficult. No. Mark said, as a social worker, are you making the choice? You're doing nothing but giving the information out and there's make an informed decision. Right.
Yeah.
Like you're never, when you go back to that self-determination, you want to help people make the best decision, but you're not making that decision for them. And that's a good point, because you have to be extremely careful to be able to educate someone and not influence them one way or the other. You also yield an extreme amount of power in positions like this as well, because you're working with people who may be uneducated. They don't understand the systems. And you could be like, oh, you have to do that, you have to go this way, or you need to go here. Like, that's unethical in and of itself. You can't do that either. It's learned too. The things that we talk about in your classes at Brescia are going to lay that really solid foundation of your social work knowledge, but you learn in practice as you go. That's why you have field placements and practicums, so that you can see other social workers working and doing the things that you discuss in class, and you can see kind of how that works. But you also, of course, like I learn every day still, and I hope to forever, because I just think that that's how you grow, is when you learn. Yeah, like, I mean, and right now, like, we're living in a time where stuff's coming up that has never happened before. So, well, I think every single one of us are learning about stuff right now. But it really is something it is really something to think about. So, just to see what your thoughts are on it. And because if you think about it, as social workers, you really want to destigmatize. Like, that might be, it could even be like, this is your line of work. Some people are like, I want to do this in social work, and I want to fight to destigmatize abortions, so that you want to promote reproductive justice, and that people aren't, going to shady places to have abortions, and it's, could take their own life. That might be something that, as a social worker, you go into that field and you fight for, to change that through advocacy and education. Because if the heart of social work is always going to be to protect human rights. We want to fight oppression and protect all human rights. Let's see. Oh, see, that's a big job. Fighting, changing policies. That's awesome, though, because, like, you have to have those people. You have to have the people that want to work at all of those different levels. And in this, when it's talking about abortion, and if you do the quiz, there's quite a bit on maybe some of the different legal cases and court cases, but you can really see, so much about how politics, how government policies affect a topic like this. I think it says in here, talking about, I don't think that wait a minute, here it is. I'm not sure that Medicaid pays for an abortion now.
Yeah, they do.
They still do. I know there's some, like, there's some, and see, there's a court case where it really gives a lot of power to the states to decide what that looks like, in their state. And then all different states have completely different rules. It'll talk about some of them in here. 10 states forbid private insurance plans from covering abortions. 21 states restrict insurance coverage of abortions for public employees. So there's a whole lot of stipulations that when the states have that power, that's just like the one I was talking about in Alabama, that it's outlawed at any stage. In Louisiana, you have to perform an ultrasound before they will perform an abortion. And if there's a heartbeat, I don't think you can do it if there's a heartbeat. Must perform an ultrasound before abortion. And then if a doctor were to perform that abortion and there was a heartbeat, then he could face up to 2 years in prison. Wow. And so there's lots of different stipulations state to state. Some of them require you coming to like 2 or 3 counseling sessions before an abortion would be performed. Some of them will require that ultrasound, because sometimes when the person who's pregnant hears the heartbeat, that makes a complete different, like, I'm not doing it. Or if I go to counseling 2 or 3 times, maybe I'm going to end up letting somebody adopt my baby. So it's a lot of that. It's very interesting to look it up to see, how it's all so different, and how government and policies play a huge role in that as well.
I work for an insurance company, and when I was in a different department, we used to have people call in to get like approvals for abortion.
Uh-huh.
But at the time, it was a Catholic company, so we would only cover it if it's like medically necessary, like, you know, like if the mother's at risk or the child already, if it's a DNC, that's medically necessary. And then like if the child's already alive, the fetus, it would have to be a medically necessary, like the mother's at risk or something.
And that's a good point, because a lot of them will be, you can have an abortion later, you know, in the trimesters, if it's going to affect the mom, like if the mom is in danger.
Yeah.
A lot of times that they will do it, you know, if it's a lot later. That's a good point.
Yeah. And then now we got bought out, so we're no longer Catholic, and they're covering them. They just cover it now.
Oh, it just covers it all together.
Yeah.
I did not realize what time it is already. It's almost 7. I'm gonna have to condense these a little bit. So what you have, I want to tell you what you have for this week. You either have the option of a paper, and it is an ethical question on page 50. Let me see. That went by so fast. You all may not think so. I don't know. Okay, the ethical question, it's a little blue box, and it says ethical question 2.1. The question is, should a pregnant woman who consumes alcohol or illegal drugs that damage her child be punished as a criminal? Should her child be taken from her? If so, with whom should the child be placed? So that is a reaction paper on that particular ethical question. Or you have the option of taking the quiz. I think it's 10 questions this time. And then for next week, you also have to read chapters 3 and 4. I think chapter 3 is talking about psychological development in infancy. So there's probably going to be a bunch of theories in there. And then chapter 4 is on social development. So after next week, we'll finish up childhood, and we'll start going into adolescence. Does anybody have any questions?
One quick question for the paper. How many pages?
Let me see. I don't have it pulled up. It should tell you on there.
Oh, okay.
Like, yeah, it'll tell you. I think it might just be like a one page reaction paper, I think.
Okay.
Yes, thank you, Kendra. I was thinking it was 1 page. And then just remember, those are in just like an essay format. Other than that, I appreciate your attention and you guys being here tonight. And if you have any questions, let me know. Just email me. Otherwise, I'm going to see if I can figure out how to get this video up tonight. And that's all I have for you guys. So I hope you have a great week, and I will see you next Wednesday.